Madam Chair, there's a tremendous amount of freezing going on.
Not for me.
I'm not, I haven't seen it here. I wonder if it's your office, Delegate.
Are you plugged in with a cord or are you using Wi-Fi, Delegate?
Well,
Oh, she's.
I'm on
busy.
Wi-Fi and I have good reception.
Okay, it might be that you want to plug in your internet connection that's a plug that should be somewhere around your desk. And that might help.
Okay. Well, that takes my second paragraph away from us. Good afternoon and welcome to the House Health and Government Operations Committee for our regularly scheduled bill hearings. As you just heard, this is a virtual committee meeting, and we ask your patience if we encounter any technological or streaming issues. Thank you for understanding. This bill hearing is being streamed on the Maryland General Assembly's YouTube channel. Today, because we have three bills that have a very common theme, we are going to group back in two separate themes. We're going to group the bills and change we're going to use a modified version of our committee testimony rules. The committee is going to hear from 9 witnesses in favor of bills and 9 witnesses opposed to the 3 bills. A selected witness who is testifying on only one bill will have 2 minutes total, and I will tell folks how many minutes they have. Witnesses selected to testify on multiple bills will have 4 minutes. And as is our normal practice, the sponsors will have 5 minutes. I'd ask the speakers to please conclude your remarks when you see the timer finish. So the first 3 bills we will be hearing together are House Bills 1171, House Bill 937, and House Bill 952. With that, I am going to call on Speaker Jones, who is going to speak specifically to House Bill 1171, Declaration of Rights, Right to Reproductive Liberty. Speaker Jones.
Thank you, Delegate Collinson. Good afternoon. Chair Pendergrass, Vice Chair Pena Melnick, and members of the Health and Government Operations Committee. For the record, I'm Speaker Adrian Jones. I'm here to testify in support of House Bill 1171 to add reproductive liberty to the Maryland Constitution. In 1992, Marylanders went to the ballot and affirmed Question 6, ensuring that abortion was legal and safe in Maryland. For 30 years, many of us felt this was a settled issue. This is no longer the case. The Supreme Court is on the verge of allowing state laws that would act as a de facto ban on the full range of reproductive services in states across the country. To those who would say that can't happen here, I will point to the last 6 years of politics in this country and ask you if we have any norms that haven't been broken or tested. Putting reproductive liberty into the Maryland Constitution would ensure that a woman's right to make her own decision for her own body could not be bargained for or chipped away at. While it's hard to imagine a Texas or Mississippi style law here in Maryland, it's not difficult to imagine a governor withholding critical state funding for another program in an attempt to win concessions limiting state funding for the full range of reproductive services. And it's not hard to imagine a push to separate out reproductive insurance coverage from standard plans. Remember that Obamacare still has cost sharing that only applies to the coverage of abortions. There are lots of ways to chip away at a woman's right to make her own decision about her body. Every year, we see new legislation introduced here in Maryland to do just that. Those efforts will increase significantly when and if the Supreme Court takes the action on Roe versus Wade. Reproductive liberty is under attack across the country. This impact on young women and families will be disastrous. And as we have seen in the COVID pandemic, and with many other public health issues, the burden will disproportionately impact lower income women and communities of color. I'm confident that Marylanders will send a clear message to the rest of the country that we believe a woman has a right to make her own decision about her own body and her own life. Madam Chair, I'll let the rest of my panel discuss the specifics of the bill and answer any questions. Thank you.
Thank you, Madam Speaker. So I'm now going to call on Delegate Kelly to present on two bills. House Bill 937, Abortion Care Access Act, and House Bill 952, Access to Abortion Care and Health Insurance Act. Delegate Kelly, you will have 10 minutes.
Thank you, Madam Chairman, members of the committee. I appreciate the opportunity to present on House Bill 937 and 952, which focus specifically on how we ensure access to abortion care for all Marylanders. There are sponsor amendments that include some technical changes you may hear referenced, as well as an amendment adding 60 co-sponsors to these pieces of legislation. As the speaker mentioned, many of us have considered abortion settled law in Maryland for the last 30 years. Specifically since Delegate Rosenberg defended that bill on the House floor back in 1991, and we had the constitutional amendment in 92. I'm sorry, we had the referendum in 92 that was not a constitutional amendment. A lot has changed since 1992, however. First of all, I'm not in high school anymore. And now based on what my 17-year-old daughter wears, the fashions may be coming back. Evidently, grunge is back in fashion. But that doesn't mean the way we deliver and finance healthcare will go back to 1992. We have not kept up to date with changes in how we deliver abortion care, especially in ensuring everyone who needs it has access to care, including rural communities and low-income communities. As we know here on HGO, the fact that a healthcare treatment is legal does not mean patients have access to that care. There are provider shortages across specialties, especially in rural areas. People often face financial barriers to care as a result of inadequate insurance coverage. And these challenges can often lead to dangerous delays in care. Abortion care is health care. We need to remove unnecessary barriers to that care in exactly the same way we remove barriers to any other health care. With the 1992 statewide referendum, 62% of Marylanders voted to codify the protections of Roe. Since then, support for abortion care has only increased. When you ask that question today, 72% of Marylanders support these protections. But of course, since 1992, the way we deliver care has really changed. Back in 92, advanced practice clinicians were limited in Maryland. Today, they are an absolutely essential part of our primary care and reproductive health care delivery system. Back in 92, medication abortion didn't exist. Today, more than 1/3 of abortion care is provided through medication. Back in 92, there was no Affordable Care Act, and insurance law was entirely different. It is time for Maryland to modernize our law to reflect how abortion care is delivered today, to eliminate unnecessary barriers and address a growing provider shortage. Very important for this committee, and I know a question Delegate Schlega probably has in mind, these bills retain all of the existing religious and conscience protections for institutions and individuals who do not choose to provide abortion care. The first bill, House Bill 937, addresses abortion care provider shortage. Since 1992, the number of abortion providers in Maryland has decreased by 15%. This while the state's population has increased 28%. Unfortunately, it is easy to understand why, and I'm not trying to be melodramatic here, but tragically, since 1992, 11 abortion providers and clinic volunteers across the country have been murdered, including one shot through his kitchen window and another shot while he was in church. Everyday people who work in abortion care face harassment and threats and violence. They do this work anyway. They are our healthcare heroes. And with this legislation, they're asking for our help on behalf of their patients. Today, 2 out of 3 Maryland counties have no abortion provider. This provider shortage already has had a tremendous impact on patients' ability to access care, but the problem is only going to get worse. After the Dobbs v. Jackson Women's Health decision comes down from the Supreme Court, and that is expected sometime this spring, up to 26 states could ban or nearly ban abortion. And that includes a number of our neighbors. When this happens, There are going to be two major impacts on Maryland's healthcare delivery system. Number one, appointment wait times for Maryland patients will increase. We know that in the month after Texas's near abortion ban, appointment wait times in the neighboring states grew an additional 19 to 22 days. Number two, doctors who are trained in states with abortion bans, who move to Maryland and want to work here, will not have had adequate clinical training to provide abortion care. So House Bill 937 is addressing both of these barriers. The first thing it removes outdated physician-only language. This is a restriction that we don't need in our law and is really outdated. You will hear from the Maryland chapter of the American College of Obstetricians and Gynecologists who are here in strong support of this bill. Abortion care is within the scope of practice of nurse practitioners, nurse midwives, licensed clinical midwives, and physician assistants. In 14 other states, they are allowed to provide this care, and Maryland needs to join those states. Very important also, this legislation will not allow doulas or direct entry midwives, those home birth midwives that Delegate Kipke and I love, or podiatrists or dentists or anyone else who is not qualified to provide abortion care to do so. MedChi is not opposing this legislation. It is strongly supported by Attorney General Brian Frosh. I want the committee to note I've attached to my testimony in January of 2020, he issued an opinion that medication abortion can already be provided by advanced practice clinicians under our existing law. However, it's important to update the statute to codify that opinion to give the providers peace of mind. The AG does support this legislation. The second thing it does is establish a clinical training fund within the Department of Health so that Maryland can ensure providers who are trained in other states have access to appropriate clinical training to provide abortion care if they want to provide this care in Maryland. Robin Elliott will discuss that further. The second bill, House Bill 952, addresses barriers caused by inadequate insurance coverage. The legislation requires that insurance plans, again, except for those with a legal exemption, cover abortion care. Most plans already do this. It does not apply to plans with religious exemptions. It also requires plans that cover abortion care do so with no deductibles. We know from research that deductibles can cause delays in care, which is exactly what we are trying to avoid. It also requires Medicaid continue covering abortion care. Medicaid has covered abortion care since 1979 in Maryland, so we already do this. You can see from the fiscal note, there's no meaningful budgetary impact. The legislation would make this funding permanent and not subject to a budget debate every year. It says basically that the same rules should apply to Medicaid that apply to private insurance. In other words, low-income people do not have somewhat less of a right to the reproductive liberty described in the Speaker's bill than anyone else. It's about equity. We'll hear from Lisa Jordan from MCASA about why Medicaid language needs an update. The insurance carriers and Medicaid are not opposing this legislation. There is a coalition in support of this bill. Not everybody will be able to speak today, but it is broad and diverse. Maryland Legislative Agenda for Women, Maryland Network Against Domestic Violence, Commission for Women, Public Justice Center. The file goes on, but I think it's really important you note the personal stories that are in the file. And so I'd like to use my last minute here to make sure that Victoria Adibari and Alexandra Solano from my office have the opportunity to share a few personal stories with you. So with that, I will toss it to Victoria, followed by Alexandra, and then we'll go to the panel, starting with Robin Elliott. I really urge a favorable report on all three bills. Thank you so much. And Madam Chairman, if we could hand it over to Victoria and then Alex.
Absolutely. Victoria?
Good afternoon. I'm Victoria Adibari, a senior community health major at University of Maryland, College Park, and I'm highlighting the testimony of Layla. Layla lives in Montgomery County and has a PhD in biomedical engineering. Last spring, during a planned pregnancy, she suffered a rare medical issue that made it necessary to obtain an emergency abortion. Despite living in an area with numerous providers, being medically literate and financially secure, she faced significant barriers to obtaining the emergency abortion care she needed in a timely manner, losing some of her sight and almost losing her life in the process. She urges members to please imagine a pregnant patient in similar medical distress who lives in a Maryland county without an abortion provider, or a patient whose insurance would not cover their abortion. Now I'll turn it over to Alex to highlight another statement.
Okay, Alex Solano.
Good afternoon. I'm Alexandra Solano, a junior communications major at Washington College. Chandler, currently a student at the University of Baltimore Law School, grew up in a religious environment and was not taught sex education. Unexpectedly pregnant in college on the Eastern Shore, her access to care was geographically limited. With no providers nearby, she was able to obtain abortion care 90 minutes away in Delaware, only because her boyfriend had a car and they had the joint funds to cover the cost. In her testimony, she reflects on the impact of access to reproductive care and on her life path as compared to her sister, who is struggling financially to raise her children. I thank God for helping to break what I felt was a generational curse. But what I realized now was actually the result of a lack of resources, education, and access to reproductive health care, including abortion care. Now I'll hand it back off to Delegate Kelly.
Thank you. Thank you, Madam Chairman. In closing, I would urge the members of the committee to read all of the personal stories and again, urge a favorable report for all three bills. Thank you so much.
Thank you, Delegate Kelly, Victoria, and Alexandra. We're going to hear from the panel of proponents first. And we're going to start with Robin Elliott, who is speaking on all three bills, so she will have 4 minutes. Robin Elliott.
Good afternoon, everyone. Robin Elliott here today on behalf of Planned Parenthood of Maryland. And I am so pleased to be here as a Maryland resident in front of this committee in the chamber of this House of Delegates, because the leadership really sees that we have both a need to protect our future generations. I couldn't agree with the speaker more on her comments, as well as recognizing that concrete steps are needed now to address access issues that we have in Maryland today. As you heard from Delegate Kelly, there is no way to overstate the threat that reproductive health faces in our nation today. The Dobbs case, which has been heard by the Supreme Court and will be decided by June, could either overturn Roe v. Wade or seriously damage Roe v. Wade. And if it doesn't overturn Roe v. Wade, there are 24 other cases in the pipeline to do so. As we have seen with Texas, the neighboring states, and even in Maryland, we have seen Texas patients at Planned Parenthood of Maryland are profoundly impacted when a state bans or severely limits abortion. So just imagine Texas and then think of 26 states doing that as early as the summer. We are facing a very urgent need to improve access in Maryland. We think the time to do these concrete things as well as protect the future is now. In a poll conducted by Planned Parenthood, by Lake Research Partners, we found, and I was thinking of that 62% figure that Delegate Kelly mentioned, we found that 79% of likely voters want to protect all reproductive health options for Marylanders, including abortion care. So in short, what you have in the bill, as Delegate Kelly mentioned, really innovative work around looking at our provider workforce and really relying on the same strategies this committee has relied on when expanding access to primary care, behavioral health services, looking at our advanced practice clinicians, our nurse practitioners, our nurse midwives. They are already allowed to do abortion care in 14 states. And is being supported by the Attorney General through an AG's opinion, as Delegate Kelly mentioned, and in support of the bill today. And finally, on the insurance coverage, you will hear from other proponents that the way insurance coverage works, including Medicaid, is not very well. While there may be coverage, the barriers placed within that coverage are delaying care. In a study, up to 52% of people delay care because not having the resources to pay for an abortion care service. Up to 25% of those people are insured, and many more have Medicaid. We look to these bills as equity to ensure that no matter where you live in Maryland, and no matter what kind of insurance you have, whether it's Medicaid or private insurance, that all Marylanders have the same access to the health care that they need, and that abortion care is health care. Thank you.
Thank you. We'll move to Diane Horvath, who will have 2 minutes.
Hi, thank you for allowing me to speak today in support of House Bill 937. My name is Dr. Diane Horvath. I am an OBGYN physician with subspecialty training in complex family planning, and I've been providing abortion care for 16 years. I work in Catonsville and also travel to Alabama once per month to provide abortions in 2 clinics there. My work has made me keenly aware of the precariousness of abortion access in the US, particularly as we wait for a Supreme Court decision that could weaken or overturn Roe. The experiences of patients who have abortions here in Maryland stand in stark contrast to what my Alabama patients must go through to get a safe and common medical procedure. One of the greatest barriers to access to abortion is the lack of providers. This is due to a shortage of training opportunities, as well as to a coordinated campaign by anti-abortion extremists to threaten and intimidate us. I know firsthand how difficult it is to obtain abortion training, even as an OBGYN. Many residency programs would like to, but cannot offer this training because of state level legislation specifically restricting them from doing so. I also have firsthand experience with anti-abortion violence, the worst of which was when I found a photo of my then 15-month-old daughter on a website designed to frighten providers away from this work. We need more Maryland providers willing to be trained in this essential work, and I am thrilled by the possibility of my advanced practice clinician and midwife colleagues providing abortion care. There is ample evidence from other states that APCs and midwives are safely able to provide routine abortion care, and that this has improved abortion access. The healthcare landscape is changing rapidly, and APCs and midwives already make up an indispensable part of the workforce. Abortion provision is well within the capacity of these clinicians. In conclusion, I don't think it's possible to overstate how devastating a post-Roe landscape will be. There are at least 21 states certain to act quickly to ban abortion completely, and the people who live in those states will not stop needing abortions. I urge you to support this legislation and help Maryland take this opportunity to stand on the side of equity and justice. Thank you.
Thank you. Samantha Hyacinth, you have 2 minutes.
Thank you, Madam Chair and members of the committee. My name is Samantha Hyacinth, and I am a nurse practitioner who has provided abortion care in Connecticut, which is a state that allows advanced practice clinicians to provide abortion care. I will be reading a statement from a Maryland provider about an example of how the Maryland's physician-only law negatively impacts patient care. The Maryland provider was not comfortable giving this testimony themselves because of concerns for their practice and their safety. Here is just one example from just the other day in my office. I had a patient who was a single mother of 2. She drove over an hour to get to my office for a medication abortion. She told us that she had a long history of anemia during her medical history, and sure enough, her hemoglobin was low. She was constantly dry heaving from pregnancy nausea and looked exhausted, though she was very early in pregnancy. With her low hemoglobin, she needed an in-office procedural abortion so her bleeding could be safely managed. This news was devastating to her. Getting herself to Baltimore for an appointment as a single working mother was nearly impossible. Taking another day off from work because of pregnancy nausea or another appointment was going to impact her family financially. She proceeded to take iron supplements, nausea medication, and returned to our office every few days for a hemoglobin check. After 2 more weeks and 4 visits, she finally had a hemoglobin level sufficient enough to proceed with a medication abortion. If I had been able to do an in-office procedure for her on that very first visit, I could have saved her 4 additional appointments, 2 weeks of extra medication and pregnancy side effects, and multiple paychecks. This process was so difficult for this mother, and I could have made that process easier if you remove the physician-only clause associated with abortion care.
Thank you. Mary Shoney, you have 2 minutes. Mary Shoney. Richard, do we have Dr. Shoney here?
That I know of.
I believe this is Dr. Verma. I believe that I'm testifying on behalf of ACOG today in place of Dr. Shoney.
Oh,
She'll be
okay.
testifying tomorrow, so sorry about
Okay.
that.
Dr. Verma?
Thank you, Madam Chairman. My name is Dr. Nisha Verma, and I am a board certified OBGYN who provides full spectrum reproductive health care. I am also a fellow of the American College of Obstetricians and Gynecologists, or ACOG, and I'm here today on behalf of ACOG's Maryland section to express strong support for House Bill 937. ACOG, which represents over 60,000 clinicians dedicated to advancing women's health, strongly supports advanced practice clinicians providing abortion care to increase access to safe, effective abortion for those who need it. We know based on robust evidence that advanced practice clinicians who are properly trained can provide first trimester aspiration and medication abortion that is just as safe and effective as that provided by doctors. I personally have worked with many advanced practice clinicians trained in women's health care and know that they have the skills and knowledge to safely provide this care. Laws requiring that only physicians or OBGYNs provide abortion care diminish the number of qualified medical professionals who can provide this care and block people from obtaining safe, legal, and accessible abortion. Maryland, like many other states in the country, currently has a shortage of abortion care providers, with approximately 70% of Maryland counties having no clinicians that provide abortion. As an OBGYN who provides abortion care myself, I have seen the toll that this lack of access has on my patients, especially adolescents, people of color, those living in rural areas, and those with low incomes, among others. Many of my patients struggle to take time off work, find transportation, and set up childcare so that they can travel the hours it takes to get to the nearest abortion care provider and get the medical care they need. We as a community have an obligation to remove unjustified and unscientific barriers to abortion care and to pass House Bill 937. Thank you for your time.
Thank you. Liz McCann, please, you have 2 minutes.
Hi, everyone. I'm Lynn McCann. Thank you for having me today. I am with the Baltimore Abortion Fund, which is a nonprofit organization that provides financial and logistical support so that people can access an abortion. We're here today to testify in support of House Bill 952. You might think that people calling our helpline for financial support are uninsured. In fact, they often have insurance that is inadequate to meet their needs and inadequate to fully cover the cost of their care. That includes many people who are enrolled in Maryland Medicaid, who represent about 5 to 10% of the people that our organization supports. We've committed over $36,000 to Maryland Medicaid enrollees who were not able to use their insurance to fully cover the cost of their procedure. And this is part of a broader pattern that have serious financial and emotional burdens for many of our callers. If you're not able to use the insurance coverage that you have to fully cover the cost of your abortion, many people are forced to fundraise. And that can be very emotionally draining. And if they're not able to come up with enough money by their appointment date, it often forces people to reschedule their appointment and can cause the cost of their procedure to go up as well. As we all know, abortion is time-sensitive, essential healthcare, and it should never be delayed because of the insurance coverage you have or not having enough money to make it deductible. So we're really excited to testify in support of this legislation that will remove some of these barriers to access for abortion care and make abortions more affordable, accessible, and equitable for all Marylanders, regardless of what insurance coverage they have. Thank you.
Thank you. Andrea Williams Mohammed, you have 2 minutes.
Yes. Greetings, Madam Chairperson, Co-Chair, members of this committee. I am Andrea Williams Mohammed, a doula and reproductive justice advocate serving families primarily in Baltimore. I currently serve on several stakeholder groups centered on maternal and infant health. I stand in support of both bills. This is solely not about abortion, but about access to care. And this care must be congruent with current initiatives to address maternal health disparities and improve overall maternal health in Maryland. This access especially is true in the Baltimore metropolitan area, but most importantly in the areas of the Eastern Shore, Western Maryland, and several rural areas in North Maryland. For me, The access to care also must address the expansion of providers who reflect and are knowledgeable and culturally sensitive to the women and families in which they serve and support. Both bills seek to provide and address the basic tenet that women, femmes, and birthing persons have access to the full spectrum of reproductive health options and be able to choose who they want to provide those services. In a state with one of the highest statistical rates of maternal and infant mortality and growing percentages of morbidity, placing any stipulations and restrictions of access to care places thousands of Maryland families at risk. I stand in support of both bills, especially the amendment to ensure the expansions of providers to be reflective, inclusive, and diverse. So I urge a favorable support of this bill. Thank you.
Thank you very much. Lisa Jordan, please. Lisa Jordan.
Good afternoon, Madam Chair, Madam Vice Chair. I'm Lisa Jordan with the Maryland Coalition Against Sexual Assault. We're the coalition of the rape crisis centers across the state of Maryland. We're here supporting all three bills, House Bill 952, 937, and 1171. Abortion care access is a critical piece of healthcare for rape survivors and survivors of reproductive coercion. The CDC reports that almost 3 million women in the US experience rape-related pregnancy during their lifetime. And a 3-year longitudinal study of rape-related pregnancy in the US found that fully 5% of rape victims of reproductive age became pregnant as a result of the rape, with the majority of those pregnancies in adolescence. Of these rape survivors, half choose to terminate the pregnancy. Abortion access and care is also important for survivors of reproductive coercion. Reproductive coercion is a form of intimate partner violence where a woman's partner tries to control reproductive decisions by preventing access to or tampering with birth control, or by forcing intercourse with the intent of causing pregnancy. Survivors of both rape and reproductive coercion need access to abortion care if they become pregnant. Let me comment specifically on access to abortion care for poor women. As you've heard from Delegate Kelly, Maryland currently enshrines stigmatizing requirements for Medicaid abortion coverage every year in the annual budget bill. And these requirements have been the same since 1979. The budget language requires that survivors of sexual assault or incest to file a police report or a social services agency report in order to obtain this basic abortion care coverage. This ineffective screening is completely inadequate given how few survivors report sexual assault or incest. But moreover, Maryland's current policies send the unmistakable message that survivors who disclose rape or incest should be viewed with suspicion because they have to report in order to get their health care coverage. These bills will eliminate these disrespectful provisions and replace them with supportive policies that help sexual assault survivors have access to needed health care. So for those reasons, we urge the committee to issue favorable reports on all three bills.
Thank you very much. Lily Balurian.
Thank you so much for having me. My name is Lily Balurian. I use she, her pronouns, and I'm a resident of District 14. I am also the executive director of Pro-Choice Maryland. Pro-Choice Maryland is the political leader for abortion access and reproductive freedom in our state. I am proud to speak in support of this historic abortion access bill package. Access to safe, legal, and accessible abortion and reproductive health care is not only a moral imperative, it has enormous social, economic, and health benefits to individuals, families, and communities. The right to an abortion is incredibly popular, but remains in dire peril nationally. This means that states such as ours must act to improve access to ensure that Marylanders' right to reproductive liberty is preserved in the strongest of ways in preparation for a post-Roe landscape. We know that bans on abortion harm pregnant people with particular impact on people of color, inappropriately interfere in the trusted doctor-patient relationship, are linked to negative maternal health outcomes, and serve an agenda that would eventually have all pregnancy outcomes scrutinized, controlled, and criminalized. We must instead trust and empower pregnant pregnant people to make the best decisions about their lives and their pregnancies. At Pro-Choice Maryland, we strongly applaud these common sense bills to further enshrine the right to access reproductive freedom in Maryland. I urge the committee to lead the way, honor abortion access as essential, vital healthcare, and to return a favorable report on all three bills. Thank you.
Thank you. Michelle Siri, please.
Yes, good afternoon, Madam Chair, members of the committee. My name is Michelle Siri. I'm the Executive Director of the Women's Law Center of Maryland, statewide nonprofit legal services provider dedicated to ensuring the physical safety, economic security, and reproductive freedom of women in Maryland. Here today in full support of HB 1171, as well as HB 937 and 952. I'm incredibly grateful for the opportunity to testify on these bills and for the leadership of Speaker Jones and Delegate Kelly. In its landmark ruling Roe v. Wade, the Supreme Court recognized that the right to abortion is a fundamental liberty protected by the Due Process Clause of the 14th Amendment. And while the Supreme Court has continued to uphold Roe over the past almost 5 decades, including as recently as 2020, almost immediately after the decision was issued, courts and politicians attempted to chip away at those rights. And since 1973, states have enacted more than 1,300 abortion restrictions nationwide. In December of 2021, the Supreme Court heard arguments in Dobbs versus Jackson Women's Health Organization, a case in which the Women's Law Center was very honored to participate in an amicus brief. And despite nearly 50 years of Supreme Court jurisprudence, this is the first time that the court is taking up the issue of pre-viability abortion bans since Roe. And the question now isn't if abortion rights will be restricted, but how badly. And even if Dobbs isn't the case to overturn Roe, there are at least a dozen cases teed up right now in a pipeline waiting to get their chance. So if we want to ensure reproductive freedom for generations to come, we must act definitively and explicitly. Constitutional amendment is our strongest protection to ensure meaningful access to the full range of reproductive health care. And further, by including the strict scrutiny standard, in other words, by saying that the state cannot infringe upon the right unless justified by a compelling state interest achieved by the least restrictive means, we would ensure that the right to reproductive liberty is unequivocal. Of course, the right to reproductive freedom must be more than theoretical, and so we're also excited to support access to abortion through expanding the scope of practice and insurance coverage. But in closing, it is no longer enough for Maryland to be just pro-choice. We must guarantee those fundamental rights to reproductive liberty today in order to have them tomorrow. And for those reasons, I urge a favorable report on HB 1171, 937, and 952. Thank you.
Thank you. I want to thank the panels for their testimony. I will now open it up for questions from the committee, and we'll start with Delegate Morgan.
Thank you, Madam Chair. My question is, and Speaker Jones or Delegate Kelly, either one of you can field this question here. But my question is on House Bill 1171. That enshrines abortion access into our Constitution under Article 48. I just want to read the first 5 lines of that. It says that every person as a central component of the individual's rights to liberty and equality has the fundamental right to reproduction liberty, which includes the right to make decisions regarding the individual's own reproduction, including but not limited to the ability to prevent, continue, or end their pregnancy. So that's a pretty open-ended statement. It's in the Constitution. When you put stuff into the Constitution, it applies to everyone, and basically with very little limits. My concern is about late-term abortions. Currently, Maryland does limit access after 24 weeks. Would you be willing to modify the language in this to ensure that late-term abortions remain limited?
Delegate Kelly.
Thank you. I think that the appropriate person to actually answer this question would be Michelle Siri. I think she's got the expertise in how constitutional amendments work and how this would intersect with our current law.
Okay, thank you.
Thank you, Delegate
Michelle
Kelly.
Siri.
Thank you, Delegate Kelly, and thank you, Delegate Morgan. I think I want to make sure that we're very clear on a few things. And one is that there's no mandate within this constitutional amendment. It is simply saying that the state cannot restrict certain rights and liberties. I think the second thing that's really I want to make sure is explicit is that it's fundamentally incorrect to say that any of our existing laws would be invalidated. We can look actually at other states right now to see that that hasn't happened. So Florida, for example, has it within their constitution, right to privacy that has been extended to abortion rights. And certainly it never invalidated their existing laws on the books. And then the third thing I would just say is that just like any other statute or constitutional amendment, anything that would come up before the court, things would have to be challenged first, and then it would have to go to the court, and then the court would have to determine whether or not, just as it says, whether or not there's been a compelling state interest achieved by the least restrictive means. And so that's the standard that's there. So I can't answer what exactly would happen, but that's the framework that we're working with. One, that it's not a mandate, that it is simply a restriction of what we can't do. And then the second part is that, it clearly is not going to invalidate things just by having the constitutional amendment.
Thank you. We'll move to Delegate Kipke.
Thank you, Madam Chairman. I don't really understand. Maybe somebody can help later answer that question better. It seems like that's pretty crystal clear that the legislature can't have any restrictions. That response sort of confused me, but I'd like to get better information on that. My question is specific to adolescents and children as it relates to what any type of, birth control or abortion. I don't know if Robin would be the right person. I'm curious as to how does this impact minors? How would this constitutional amendment impact minors?
Robin, is that you?
I think that might be me and Michelle.
Only one.
So right now, as I think many of the committee know, that minors have the ability to obtain abortion care if the physician deems that they are mature enough to consent or that the minor is in danger of some way. Otherwise, the provider is required to notify the parents. And then on birth control, again, minors can consent. And that is in the terms of the provider has to deem them mature enough to be able to consent. So Michelle, I think the second part of the question.
No, I just want to know how this constitutional amendment changes existing practice for minors. It seems like it would not allow for the current rules to continue to apply. And I'm just wondering if you could provide some clarity to that.
Would that be Michelle Siri?
Can I answer? Is that okay? Thank you.
Yes.
So again, there's nothing within this constitutional amendment that would invalidate what's already our existing laws.
Can you explain that better? Because you explained that previously. And I don't mean this at all to be offensive or short with you, but you confused me further. The language of the constitutional amendment seems to say that the legislature cannot restrict or create limitations or that's pretty clear. And the Constitution is the ultimate ruling document. So how would the passing of that amendment to the Constitution not wipe out simple protections for parents and their children? And I don't understand. It seems like what you're saying contradicts what you're trying to do.
No, so again, there's two things. One is that there's that second part of the constitutional amendment that wasn't read, which is that the language is that the state may not directly, indirectly deny, burden, or abridge unless justified by a compelling state interest achieved by the least restrictive means. So what we have seen across the country when other states have enacted constitutional amendments enshrining the right to abortion is that it is not overturning the existing law. There's no mandate that requires the state to do anything. It's simply saying that we cannot put in additional restrictions, but we can put in restrictions so long as it meets that compelling state interest achieved by least restrictive means. So what would have to happen, just like any other bill that is passed, if someone wanted to challenge and say that, we can no longer have this statute in place, they would have to challenge that in the court, and then the court would apply that test. Does that help clarify?
Thank you.
Thank you.
Thank you, Delegate. Delegate Salega.
Thank you, Madam Chair. And I have two questions. The one is Speaker Jones's bill, and I don't know if I should direct it to her or whom, but we've had a couple of questions on late-term abortions, and we know first of all, that, Delegate Morgan said there are limits on abortion after 24 weeks, but, on the public record here, the only limit on abortion in Maryland is that the physician performing the abortion gets a statement from the woman that says she is having mental health issues. And that would then allow a full-term healthy baby to be aborted. And we know this happens right here in Maryland. We know it's happening in Montgomery County. Full-term healthy babies being aborted. So by enshrining this in the Constitution, is it your desire to continue allowing this to happen? Or do you want to have full-term abortions in Maryland of healthy babies? Or are you willing to put some threshold on there?
Robin, I'm going to go to you. Robin Elliott.
Good afternoon. So in Health General, section 20-209, what it says is that the state may not interfere with the decision of a woman to terminate the pregnancy before the fetus is viable. So there's no post-viability abortions, and then that viability is determined by the provider of care. So recognizing that each pregnancy is unique, and so I don't believe that what we're discussing and the Speaker's constitutional amendment would in any way allow for abortions post-viability.
But they're happening now, Robin. Are you telling me that late-term abortions are not happening now? That's post-viability.
There are no post-viability abortions that I am aware of.
Well, I will tell you there are. They're going on in Germantown. They've been happening in Montgomery County. They used to happen in Cecil County. That abortion provider was put out of business, thank goodness. But thank you, Delegate Cullison, but this is important for the public record. This is very important that the public understands and that lawmakers understand that we have currently in the state of Maryland full-term abortion going on, and the only caveat where you're calling viable is that the mother of the baby says that her mental health is in jeopardy. It has nothing about the baby. So I hope that we can talk about this when we talk about the bill, because I'm sure that no one here in this Zoom call, and certainly Speaker Jones, never wants a full-term healthy baby to be aborted. Secondly, Delegate Kelly, you talked about abortion providers and there not being enough. Are you telling me they don't do abortions in the emergency room? And are you counting them? Are you counting pre-12 week, where many OBGYNs will do abortion pre-12 week? Can you quantify that for us, please?
I can do my best to answer your question, although I think we're breaking the question rule, so I will defer to the chair. Do you want to take it offline?
We're gonna answer it now, and then but we are going to move to Delegate Chisholm next.
So the abortion providers data comes from the Guttmacher Institute, which is tracking our information nationally, and it does, to the best of my knowledge, track everyone who is providing care, whether it's a sole practitioner or a large group practice, is counted as one provider.
So it's not from the Department of Health, because I will tell you, I had a pregnancy at 7 months that my daughter was sick. And when I went to the emergency room at Franklin Square, they told me to have an abortion at 7 months. I did not. And Carol did die later in that pregnancy, but I know from personal experience, this is happening. So I'm wondering about how they're counting these abortion physicians. Thank you.
Thank you, Delegate. And I would remind us that we are not debating the issue. We are getting information. This is a hearing today. Delegate Chisholm.
Thank you, Madam Chair. And this is essentially it's a broad question on all three bills. given that I did hear that we need equity and reproductive justice a few times in testimony, and given that I think we all agree now that Margaret Sanger is considered the founder of Planned Parenthood, who did say in 1939, we do not want word to go out that we want to exterminate the Negro population. Given that in 1984, Jesse Jackson, not somebody I quote very often, rallied against abortion, calling it Black genocide and comparing abortion to slavery. According to Jackson, the idea that a baby was the personal property of a mother and she could do whatever she pleased with the child was the premise of slavery. And given that today's numbers of 2017, which I just looked up on the CDC, we have 6.6 abortions per 100,000 pregnancies in non-Hispanic white, and 23.8 abortions per 100,000 in non-Hispanic Black, which is obviously almost triple the number. What number would equal equity? When I hear the term equity, that we need equity in reproductive rights, I understand there's a shortage. There's a shortage across the country in just about every field. But when I hear that we need more, what do we have a gold number for abortions? Do we have a gold number for providers? And anybody can answer the question.
Delegate Kelly, do you have someone to?
I would love to refer that question to Dr. Horvath.
Okay.
Thank you. I think when people bring up things like Black genocide, Margaret Sanger, who certainly has a troubled history, and I think Planned Parenthood's done a very good job of, moving their organization forward and away from eugenics messages, which were really common at the time. I think bringing these things up and invoking slavery images really is a shorthand way of saying that you don't trust Black women and families to make decisions about what's best for them. I think the issue here for equity and justice is people being able to determine the best for their own families, their own lives, their own pregnancies. So I think the equity and justice comes from allowing people the freedom and the agency to make decisions about their own health care.
Thank you. I just asked about the equity and justice for the unborn baby.
I understand.
Madam Chair.
Delegate Krebs.
Oh, thank you, Madam Chair. I've been trying to listen to this very carefully, and we keep hearing about equity and reproductive rights. And as this committee knows, I'm always asking, what's the problem we're trying to solve? I haven't really heard why we don't have that currently with current law. I still not heard why this needs to be enshrined in the Constitution, and why is it not available now, and is there not equity? It's always like, I keep hearing it could be this, could be that, but is it a problem now? Because it seems to be that the issue of putting in the Constitution makes it so broad that we need to have a larger discussion about post-viability, abortion allowed in Maryland. And the question is that what we're trying to get to? So is it really about this equity issue, and what is the data to support that people do not have this available? That's the first part of the question. And then if that is true, why would we not have a broader discussion about making sure there are these limits that have already, Robin, you just said they're in place, that nobody post viability is allowed in Maryland now. So if that is the case, and you all agree to that, why would we not at least enshrine that into the Constitution as well?
Delegate Kelly, do you want to assign that to someone?
I can do my best to answer it, because I do appreciate Delegate Krebs always asking the question, what is the problem we're trying to solve? So I will just say, and I can speak to all three bills because I think they're all trying to solve for the same problem. We do have barriers in access to care today that are documented and well established, and the testimony in your file will point to them. I'll just highlight one. We received testimony from Potomac Family Planning, which is a clinic, and it touched my heart as someone who grew up in a low income family. The patient seeking care needed insurance coverage, and she didn't know if her insurance was going to cover the procedure. When she found out, what she told the person on the telephone who submitted this testimony was, thank goodness, my two children, Christmas is coming. They were gonna not get Christmas gifts because I needed to use every spare dime I had to cover this abortion. To learn that her insurance covered it made sure that her kids had Christmas that year. And so to me, that's the meaning behind the access portions of this. In terms of the constitutional amendment, we did already do a referendum codifying our law back, again, 30 years ago. Constitutionally protecting it elevates it to that next level. It does make it harder to impose further restrictions. And that's the goal of the legislation. From my perspective, it's very important that we take a stand today and say, as we're seeing increased pressures that are inevitably going to happen as a result of the actions of our neighbor states. The governor of Virginia just appointed an ambassador for the unborn, for example. We know that the state of Pennsylvania is looking at doing a constitutional amendment in the opposite direction. As we can't avoid the national context on this issue. And I think the constitutional amendment helps us ensure that whatever is happening on the national level, Maryland is assured that we are not going to go back. So I think that's the meaning for it on that bill. Thank you very much for the question.
And what about the second part of the question was about, if that's true, and you say we already have post viability in law, why would we not put the post viability piece in the Constitution if we're codifying our current practice?
So I will again answer very similar to what Michelle Siri's answer was. If we look at the language of the constitutional amendment, and I think this is part of some of the confusion I read in the opposition testimony, which I did read all of it, and I take it very seriously. And I was quite concerned that I think there is a misunderstanding within some of the folks who are opposing the constitutional amendment, exactly what it means in practice to have the constitutional amendment. The language is broad, and it talks about reproductive liberty in terms of preventing, continuing, and ending pregnancy. We have done so much in the state of Maryland, for example, to advance contraceptive access. We have done that in a bipartisan way. We have done so much in the state of Maryland to advance childbirth related issues. I'm so proud of the work we have done in that space. I'm hoping we can do more on the access to abortion care as well. But none of that changes as a result of this constitutional amendment. All it does is say that any future laws, you must have a compelling state interest in order to restrict. And that's all that the point of the constitutional amendment is. So I can answer that question over and over again. I can't make you believe it. So that seems to be the difference. Thank you.
Thank you.
Okay, so Delegate Bagnall.
Thank you, Madam Chair, and thank you to the bill sponsors. I want to make sure we're sort of focusing on the bills that are in front of us. So I think this question might be to Delegate Kelly. For private insurance and Medicaid, do we have equity and coverage for contraception and pregnancy care?
Yes, we do in the state of Maryland. I think we're just trying to close that gap for abortion related care. So we already do this. I think it's very, very important that we treat all people the same way in terms of any of these reproductive issues, whether it's someone who is on Medicaid or private insurance. And that is the heart of this bill for me. Thank you so much for the question.
Thank you very much.
Delegate Lewis.
Thank you, Madam Chair. To adjust my volume a little bit. Thank you to the bill sponsors for bringing these important bills. I listen with interest to the discussion because I grew up in a state, I was born and raised in the state of Indiana, where access to abortion services was then and is now extremely limited. And also, if I may, Madam Chair, if you'll forgive me, but I also listen with interest as a person whose father was a physician who provided abortion services in his clinic for many years, and as a person who's worked in reproductive rights in over a dozen countries around the world. And it strikes me as remarkable that we're having this discussion in Maryland in 2022. But having grown up where I did and the experience that I have, I'm really curious, looking at the map of Maine, which is very rural and has a particular history and profile. It's got much broader access to reproductive care, abortion care. And I'm wondering how the state of Maine is able to outstrip Maryland in that regard. Thank you. I think the question, whoever is best to answer that question.
I think I'm going to send it to Robin Robin Elliott.
So
I'm getting a
thank you
nod
for
from the
the
sponsor.
Thank you for that question, Delegate Lewis. You will have in your packet testimony from Planned Parenthood of Maryland, and I think the information you're referring to, Delegate Lewis, I just want to hold it up so everyone can see. Is this map where Maryland, which is here, in terms of access, the number of counties without abortion providers is comparable to the states south of us, which have worse abortion right laws. Maine has abortion care providers in about 70% of their counties, and they are the most rural state on the East Coast. And they did that deliberately. They changed the law to recognize advanced practice clinicians. So they're able to get nurse practitioners, nurse midwives, their physician assistants out in their rural counties to not only provide abortion care, but other reproductive health care as well. So Maine really turned this around when they changed their law regarding physician-only restrictions.
Thank you.
Thank you. Delegate Saab.
Thank you, Madam Chairman. So if this bill, let's say, gets voted on, it passes, then can a provider that is against abortion refuse to perform the abortion? And if they do, will they be violating that individual's constitutional rights? And what protection do they have if this is against their own beliefs?
Michelle, is that yours?
I'm happy to answer that. Thank you. Thank you, Delegate, for that question. And the answer is nothing changes. Maryland already has those abilities, and it comes from a couple of different areas. Maryland allows providers and hospitals, in fact, to take a conscientious objection, if you will. And it's based out of a couple things. One is Supreme Court jurisprudence, cases like Hobby Lobby. It's not entirely on point, but it's pretty analogous. But then there's also something called the Walden Amendment. And that is basically would allow or would prevent any state from receiving funding, federal funding, if they were to prevent a practitioner from taking that conscientious objection. And so there's nothing in here that would change that. The Walden Amendment is firm and strong and working nationally, and Maryland law has been pretty clear on that.
Okay,
Thank you. Thank you.
Delegate Riley.
Thank you, Madam Chair. Yeah, with all, I guess for all three of these, I just see these as, making me think that I'm afraid of what's happening and the message that we're encouraging young women to say that pregnancy pretty much is disease and there's an easy fix to cure that disease, and that is by having an abortion. And I do believe, which, we may differ in the philosophy that, I believe, once fertilization happens, it is a live human being. So we're encouraging them to terminate a live being. And all the studies that I've seen and have talked to people, having an abortion really does cause a real live medical effect on those that abort their babies in several different ways. Emotional, first of all, and then another thing would be they have health issues to where they may not be able to become pregnant later. Do we have any stats of going back to these women and and finding out how many of them can no longer have children? Especially if the baby's like sucked out. I've heard there's been a lot of medical problems that happens during abortions. Do we have that information? Is anybody capturing how this is really affecting those young women that are having these abortions? So I've heard that it's very serious. I don't know who can answer it.
Yeah. Robin, is that yours?
I think Delegate Dr. Horvath would be
Dr.
good to
Horvath?
answer that one.
Okay, thank you. Dr. Horvath?
Not sure where the information that you are getting is coming from, but this is a very well established by research that abortion is not only 10 to 15 times safer than going through a birth, which is not to say that people shouldn't have births. It's to say that we need to be honest about the evidence. Another very well demonstrated thing is that the only thing that predicts emotional problems after abortion is emotional problems before the abortion. So I don't think that's an argument against abortion. I think it's an argument for better access to mental health testing and treatment. And then I think in terms of the consequences for future pregnancies, also very well established that uncomplicated abortion, and again, it's 10 times less complicated than births, does not result in impact to future fertility. And furthermore, pregnancies are much, much healthier when someone's ready and the pregnancy is wanted. And so abortion actually helps people go on to be better parents in the future or to parent the children that they already have.
So just a follow-up question. Do we know how many women have multiple abortions and how it affects their body?
I think that we could certainly find the numbers for this, about this for you. But again, multiple abortions do not have a negative effect in terms of how many that you have. It's the fact that, you know, abortions, when they're performed safely and accessibly, and this is really what these bills are about, is to get people better access than we have now to safe, affordable care. When abortions are done safely, they do not affect future fertility, no matter how many of them you have.
Okay, well, I would hope that you could follow up with maybe some of the stats on, you know, multiple abortions, because again, I do think that with these bills, we do encourage that process, and which I do not agree with. So thank you.
Delegate Kaiser.
Thank you, Madam Chair. And I do have a question for Dr. Horvath, but I just first wanted to note, hearing the phrase pregnancy is a disease, the only time I've ever heard that is by the last speaker. I've never heard anyone else suggesting that. I would argue there is no greater gift than having a child, and what every baby needs is being wanted, loved, accepted, and encouraged. My question for you, Dr. Horvath, as an abortion provider here in Maryland, and thank you, I do want to ask how many of your patients travel from rural areas of Maryland and what kind of roadblocks they face, because I'm all about healthcare advocacy, equity, and access. So I'd love to hear about that component.
We get a significant number of patients who travel from rural areas. And I would say that the experience that they have is actually quite similar to the patients that I see in Alabama. So the restrictions in Alabama make it hard for everybody to get care. And, you know, the geographic situation of the clinics in Maryland and the lack of providers that are, you know, proximate to where people live creates a situation where people are marginalized in much the same way in states with as they are in states with lower access. So I think it has created a dichotomy between people who can easily access care, as it should be, and people who have to travel and go through extraordinary circumstances to get there. People have to do things like find childcare, find transportation. Plenty of folks don't have cars, and we don't have a transit system that can get you from the Eastern Shore to the Baltimore or DC Metro. So I think, you know, your question really highlights a disparity that exists even in a state where we think about access is so much better than some of the other states that people live in around us.
Thank you.
Thank you. Delegate Belcastro.
Thank you, Chair Collison, and Delegate Kelly and Speaker Jones. I want to thank you for bringing these really important bills forward. This question is for Delegate Kelly. You touched on it a little bit earlier, but I think it's a point that we should really hit home. These restrictions are starting to pop up in states that surround Maryland, and I was hoping that you could take some time to elaborate on that.
Yes, thank you very much for your question. So we're pretty confident if the Dobbs case comes down in a way I would not prefer, that would allow people to further limit abortion, that West Virginia is going to be one of the first states to act. They are considering a Texas-style ban right now. Pennsylvania is considering an anti-choice constitutional amendment. Virginia, really their senior leadership, their governor, their lieutenant governor, their attorney general have all gone on the record as very hostile to abortion rights. I mentioned that they appointed an ambassador for the unborn. So many of our nearby neighboring states, we expect, will be taking actions that really are going to naturally create a pressure on our provider network in the state of Maryland that we really need to be aware of. We already feel tremendous pressure on our provider network. And, you know, it would be foolish of us to just close our eyes and pretend that something wasn't happening. We have the data from what happened to states that were adjacent to Texas, what happened to those providers. And we have to think, I think our responsibility as the Maryland legislature is to think about those Maryland patients. What happens to a Maryland patient if suddenly their appointment time is 19 or 22 or 25 days later? What does that mean for that Maryland patient? And that is why I think it's very important that we act on these bills in a timely manner. Thank you for the question.
It's chilling. Thank you for answering that. Thank you.
Thank you. And Delegate Lewis Young.
Thank you, Madam Chair. I understand we have an AG opinion on medication abortion. I'm not sure who to direct this to, but my question is, how far do you think that will go in encouraging providers to feel more comfortable in providing abortion as an option?
I think Robin Elliott can probably answer that.
Yeah, I was going to say Robin.
Delegate Young, thank you so much for that question. We are so grateful to Attorney General Frosch for that AG opinion. Some providers feel comfortable enough with that AG's opinion to be providing medication abortion care, nurse practitioners and nurse midwives, but some do not. And the reason is that abortion providers are targeted with both threats, harassment, complaints to boards. And so really to make that Attorney General opinion work, it needs to be codified. And so this legislation would do that. It would remove any doubt from the minds of our advanced practice clinicians. And I just wanted to thank, we do have an advanced practice clinician here who read a story from a nurse practitioner in Maryland who is providing medication abortion, who did not feel comfortable being identified today because of that fear. So thank you.
Thank you.
Thank you. Delegate Hill.
You know, thank you, Madam Chair. This may have already been answered. I'd like to, I guess, ask Dr. Diane, hi, how are you? It's good to see you today. You talked about Texas. So what's the difference in barriers? Texas has this, you know, I think that they've got the highest rate of teenage pregnancies, and they're the strictest state on abortion. What kind of barriers are you seeing in Texas with their very, very high anti-abortion legislation versus what kind of restrictions are we seeing here in Maryland, particularly in the rural areas? Can you do some comparison? I'm just trying to find out why they.
Yeah, I mean, I think that there's a difference between barriers and restrictions. Like all restrictions pose barriers, but not all barriers come from restrictions. And so we in Maryland see a lot of barriers that people are having that relate to travel, that relate to childcare, to finances, as we've talked about in relationship to the the insurance bill. So I think in Maryland, again, we have a much better legislative environment for abortion than in Texas, especially after the passage of SB 8 in Texas, which really decimated abortion access there. But I think the barriers here are ones that relate to people's life circumstances and their resources rather than necessarily a legislative barrier. I don't know if that answers the question.
Yeah, I think that's helpful. As I said, they've got the highest unwanted teenage pregnancy rate, so it's not really helping their just say no policy, I think. Thank you.
Are there any more questions from committee members? Seeing none, we'll move to the opponent panel. And we're going to start with Laura Bogley, who's going to speak to all bills, and she will have 4 minutes to do so.
Thank you, Delegate Collison. Madam Chair, members of the committee, I'm Laura Bogley, Director of Legislation for Maryland Right to Life. First, I object to the fact that this committee is not providing each of these important bills its own public hearing. I think that's a violation of our constitutional rights in itself. Secondly, I'm here to talk about the babies. Everyone else is talking about themselves. I'm here to talk about the babies. On behalf of the 30,000 preborn human beings that are killed each year by abortion in Maryland, I oppose this attack on the God-given and unalienable right to life. I also am responding to requests from many leaders in the Black community who have appealed to us to help stop the killing. On their behalf, I appeal to Delegate Adrian Jones to withdraw House Bill 1171, which is a death sentence for Black children in Maryland. Abortion is having a genocidal effect on Black lives, as it was intended to do from the very start. 20 million Black children have been killed legally by abortion in this nation. Abortion is now the leading killer of Black lives, more than gun violence, and the top 20 causes of death combined. At least half of all children conceived by Black women in Baltimore City are now being killed through abortion violence. I remember a time not so long ago when members of this assembly stood up to defend Black lives by repealing the death penalty in Maryland. But now those same members have declared open season on the most vulnerable human beings, Black babies. Was it not these very legislative leaders who just a few years ago tore down the statue of Justice Roger Taney, who deprived African Americans their freedom and prohibited the states from outlawing slavery on the basis that African Americans do not have the rights of citizens? But now these same leaders erect this monument of a bill to forever enslave Maryland children in their mother's wombs. Our children are not chattel to be disposed of as we see fit or for our convenience in the name of freedom or even in healthcare. As Maryland's own Frederick Douglass said in response to the Supreme Court's decision, the Constitution knows all the human inhabitants of this country as the people. It makes no discrimination in favor of or against any class of people, but is fitted to protect and preserve the rights of all without reference to color, size, or any physical peculiarities. It is time to break the chains of Planned Parenthood over the legislative Black caucus in Maryland and over Black lives so that you may have a hope and a future. As a matter of ethics, it's important to note that 60% of Democrat lawmakers were endorsed by NARAL in the last gubernatorial election. It would be advisable for any legislator who has received campaign money or other compensation from Planned Parenthood to recuse yourself and abstain from voting on these bills, which will enrich the abortion industry. Madam Speaker, withdraw this deadly bill and let the children live. We also strongly oppose the two other bills introduced by Delegate Kelly to expand abortion and public funding for abortion. By enacting these bills, you are again putting abortion profits over the pregnant patients that you should be protecting. We won't adhere to this nonsense that abortion is healthcare. Maryland women already have access to unlimited abortion through all 9 months of pregnancy, and abortionists are shielded by the law. What women need but do not have from this state is access to life-saving alternatives to abortion, which means women have no good choice. Because of abortion distortion in our state, the state is failing to provide for the legitimate reproductive health needs of Maryland women. We've been spending billions of dollars to Planned Parenthood, who has failed to prevent unplanned pregnancies, and yet we still keep paying for them, and abortion sales keep continuing to increase. The state is failing to ensure that abortion clinics are safe and acting in compliance with the few existing health regulations we have. The state is failing to address incidents of abortion-related maternal injury and death or risks of future miscarriage, preterm birth, or loss of fertility. The state is failing to protect women and girls from abortion coercion, sexual abuse, and sex trafficking. The state is failing to invest and promote in life-saving alternatives to abortion like quality prenatal care, the Maryland Safe Haven program that exists on the books but not in reality, and affordable adoption programs and foster care reform. The majority of people, whether Republican or Democrat, pro-life or pro-choice, are opposed to public funding for abortion. These bills enrich the abortion industry at the expense of our most vulnerable human beings, the preborn child in the womb. Maryland needs more care and less abortion. For this reason, we oppose these bills and ask you to do the same. Thank you.
Thank you. Ella Ennis, please. You have 2 minutes.
Good afternoon, Madam Chairman, and members of the committee. I appreciate the opportunity to be here today for the Maryland Federation of Republican Women. The Maryland Federation is opposed to House Bill 1171. The proposed constitutional amendment is written so broadly that it would allow abortion from any time from conception to birth. It would take the power to regulate abortion away from you, our elected officials, and remove all existing health and safety measures for pregnant women and force Maryland taxpayers to fully fund abortion decisions, even when in direct opposition to their personal beliefs and moral objections. No regard in this amendment is given to the man without whose contribution the pregnancy would be impossible. As a nation, we have always held that parental responsibility begins at conception. Parental rights, both for the mother and the father, begin at conception as well. There is no regard given to the resulting child. The child is not the woman's body. It is a separate human being. The U.S. Supreme Court precedents support what has generally been accepted in the medical community for decades, that viability occurs by 24 weeks of gestation. A baby can live and prosper outside of the womb by 24 weeks. The options are not either the woman's right to enter pregnancy or the life of the preborn baby. Both can survive. A woman's right to enter pregnancy is declared by the U.S. Supreme Court is not unlimited. Government and society should not abandon preborn children, especially when they have reached viability. This decision to have a woman to enter pregnancy is not unequivocally override the rights of a viable baby. It is truly a sad day when the Declaration of Rights of the Maryland Constitution is used to take away the right of a life of a baby. I urge your unfavorable report for House Bill 1171. Thank you.
Thank you. Olivia Summers, please.
Thank you, Chairman Pendergrass and committee members. My name is Olivia Summers, and I am Associate Counsel for Public Policy with the American Center for Law and Justice. Today, I'm speaking on behalf of the ACLJ and nearly 400,000 concerned citizens, including over 6,200 from Maryland, who oppose abortion. You have my full written testimony concerning the ACLJ's opposition to HB 1171. Abortion has divided our country for nearly 50 years. And as you've heard today, it is far from settled law. This is clearly so, as the Dobbs case currently awaits the Supreme Court's decision. HB 1171 appears to be a reaction on the part of abortion advocates who see Dobbs as a threat to abortion. But it is both on the wrong side of history and out of touch with what the majority of Americans desire. Gallup polling has found that at least 70% of Americans oppose abortion in every circumstance, being legal in every circumstance. 65% of Americans oppose all abortion in the second trimester, and 81% oppose abortion in the third trimester. And approximately 1/3 of Marylanders believe abortion should be illegal in most or all instances. The language of HB 1171 is both broad in scope and it is vague, and it is not possible to fully quantify the effects on the laws that HB 1171 would have. However, we can say that its effects would be seismic. Most notably, HB 1171 would prohibit future legislative efforts to place even modest limits on abortion, and it would thwart those who value innocent life and seek to protect it. Let me leave you with this question. Do you think that innocent human life deserves to be protected? For the stated reasons, and many other reasons, the ACLJ opposes HB 1171 and urges an unfavorable report. Thank you.
Thank you. I believe that David Whitney is not present. Am I correct in that? Mr. Whitney? Richard, you're not seeing him, right?
No, ma'am.
Okay, then we will go with Sandy Christensen. Ms. Christensen?
Yes, good afternoon, Chairman Pendergrass and members, and I thank you for the opportunity to present my testimony. I am presenting in opposition to HB 937. I am a board-certified obstetrician gynecologist licensed in the state of Maryland and the medical director of a free nonprofit pregnancy center support clinic in Frederick. Over the past 30 years, I devoted my career to the care of women, and that is why I'm concerned about HB 937, that it will lower the standard of care for women in our state. I don't see it as a step forward in women's health, and I believe it will lead to untold complications. I believe all women deserve quality health care. Induced abortion, whether by pills or surgery, I believe is completely outside the scope of mid-level professionals who simply lack the depth of knowledge and extensive training needed to be properly equipped to handle complications. Where is the data documenting that abortion is not a risk or not increased when performed by non-physicians? Facts matter. Induced abortion is associated with very real risks. There is no substitute for the years of training that physicians complete. Why would we want to go backwards for the quality of care for women? Wouldn't you want your daughter to have the benefit of the physician, the most skilled and experienced? I'm also not convinced that Maryland needs to train more abortion providers. According to Institute for Women's Policy Research, 70% of women in the state of Maryland live in a county with access to abortion. And Maryland ranks 3rd in the nation for best reproductive rights and abortion access with an A- rating. On the other hand, Somerset, Maryland is a maternity care desert without any access to prenatal care. And we have a C- rating for our track record with preterm deliveries with significant racial disparities. So in conclusion, I'm asking for an unfavorable report for 937. Please don't lower the bar. Keep Maryland's patient care standards strong. Invest in improving women's health through high quality prenatal care for all. And you have to ask why 90% of OBGYNs don't do abortions. Thank you for your time.
And thank you for your testimony. Francis Arlinghouse, please.
Thank you, Madam Chair. Thank you for giving me the opportunity to appear before the committee today. My name is Dr. Frank Arlinghouse. I live in Ellicott City, Maryland, and I asked the members of the committee to oppose House Bill 952. Like the other bills that we've been discussing, it is extreme. Some reasons to oppose this. This is a hidden tax. Instead of directly paying out of the state budget for abortion, it forces insurance rates up to be borne by by some subset of the taxpayers instead of the taxpayers as a whole. It also tramples on individual conscience rights by not permitting access to abortion-free insurance providers or insurance providers who won't pay for third-term abortions, which are in fact done in the state of Maryland at the Care Clinic in Bethesda, which advertises abortions up through 35 weeks. It also elevates abortion to a level beyond most medical procedures. My wife is a diabetic. Her diabetic supplies require both a deductible and a copay. In addition, it provides no limits regarding late-term abortions. As I mentioned before, this is a funding source for abortion providers. Abortion clinics in Maryland are a profitable enterprise. We are allowing this industry to profit, and we're doing it in the most extreme cases. Planned Parenthood may profess not to be aware of third-term abortions, but they have honored the medical director of said clinic, and he's nationally famous. For these and many of the other reasons expressed by speakers, other speakers, and in the delegates' questions, I ask you to oppose House Bill 952. Thank you for your time.
Thank you for your testimony. I'd like to call Vince McAvoy, please.
All right, thank you so much, Delegate. Can you hear me all right?
Yes, we can. Thank you.
Thank you so much. Shout out to Ella Ennis of GOP Women for mentioning fathers, and Olivia Summers, who highlighted the stats I was going to, so we'll skip over that part. I want to say that while I registered for all 3 bills, I was denied. In Annapolis, we have bill hearings that go on into the night in House Judiciary, Senate Judicial Proceedings. Yet HGO, led by a chair who was a sponsor of one of these bills, or several of them, elected to only give 5 to each side. So I've heard a lot of echo chamber for the last hour and a half in HGO. I'm going to speak to the particularities of the bill I was allowed in for, but the general statements likely apply to all 3 bills. HB 1120, this is Jones's bill, that every person has a central component of the individual's rights to liberty and equality, has a fundamental right, and scratches the next part up, to kill. Okay, you don't have a right to kill. At some point, this is life. This is what Delegate Rowley brought up. This is what the believers are telling you. This is what we know now, apart from the 90s. Okay, so if you compare this to the 90s, the technology wasn't there to promote and revitalize life as it is now. There weren't studies showing how infants in the womb feel pain. how they react to the external world. And this is why feminists, Planned Parenthood present the ultrasounds, which show clearly that we intrinsically recognize the person in the womb as life. In the bill that I'm looking on, that I was allowed in HB 937, Planned Parenthood is accepted as a nonprofit. These are the folks who are giving Lamborghinis to their high executives. That's a nonprofit allowed in under here. I think that's a travesty. So in closing, I just want to say that if this is about equity, say it. Say that Rosenberg's district in Park Heights, being a Melnick's district, heavily Latino, and not in favor of abortion, they want to abort the children in their neighborhoods. I urge an unfavorable on HB 1171, 937, 952, and I honestly think that this has gone on too short for this level of bill and this level of discussion. I think it's a travesty. I do thank the committee for their time.
Thank you for your testimony.
Thank you. Thank you.
Michelle Hendrickson, please.
Thank you for hearing all sides today. I'm here with Students for Life Action. We are in all 50 states on more than 1,300 middle, high school, college, medical, and law campuses. 30 of those groups here in Maryland who strongly oppose House Bill 1171. I hope you will see two things today. We've said a lot of things, but I want you to see two things. First, see those harmed by abortion, preborn children who are violently dismembered, poisoned, and discarded. See women who deserve better than abortion, like those harmed by late abortionist Leroy Carhart, who we've already mentioned. He still somehow operates here, despite being amid a lawsuit, which I have included in my written testimony. See the woman who woke up from her anesthesia, crying as her uterus was perforated, only to find parts of her baby were still left inside of her. I'm sorry, it's graphic, but it is the reality of abortion that mothers are harmed because our laws set up the falsehood that abortion is healthcare. Healthcare does not destroy, it protects. Second, see us. See me and others who came out today. I took this picture about an hour or so ago. This is us outside of the House building. We gathered today, even though, we're not inside, but we did gather because this is so important. See the majority of millennials and Gen Z in recent polling that I've included, where 58% oppose abortion through all 9 months. We are 1/3 of the voting bloc. This bill does not represent us. Do not secure a fate that does not represent us. House Bill 1171, it is about to be a catalyst of division, catastrophic, unconstitutional precedent, setting us backwards. So let's progress forward and invest in nonviolent solutions. Stop settling for the archaic practice of abortion. Thank you.
Thank you. Thank you for your testimony. And Patricia Mosley, please.
Thank you. I'm here today to oppose HB 937 Abortion Care Access Act. Any other abortion bill is just like this one that tries to lower the standards for women in the care that they're actually given. 40% of abortions are done through the violent mode of chemical abortion pills, which carries 4 times the risk of complications compared to surgical, primarily hemorrhaging and incomplete abortion. She is the one who must see and dispose of her remains of her child. In emergency rooms, visits have skyrocketed over 500% after the ingestion of abortion-inducing drugs between 2002 and 2015. So if a woman is self-managing her own abortion, why does the state need $3.5 million of tax dollars to partner with organizations, AKA Planned Parenthood, who will administer funds and train abortionists? It has been well researched that an overwhelming majority of women feel pressure to choose abortion to make others happy. Pro-abortionists will say they support women and move heaven and earth to get a woman to do the most unnatural thing. But she doesn't want abortion. She wants the circumstances to change. And this act could be like the Texas Alternatives Programs Act, which gives women access to counseling, maternal assistance, care coordination, and housing. And all of these things improve a woman's well-being and her outcomes for success. When instead what we've seen is abortion being proven to increase the risk of suicide, drug abuse, depression, and other risky behaviors. Abortion may be a quick fix for the state to deal with minorities and the poor, but the evidence shows that if you want to put less pressure on your social services, stop abortions. Instead of trying to get ahead of a life-affirming decision adoption, enshrining a way to litigate any restrictions on abortion, women in Maryland deserve better, and it's time for us to support motherhood and family building by telling women they truly can have it all. Thank you.
Thank you for your testimony. I want to thank all of the panelists for their testimony and time today. We will now open it up to questions from the committee, and we'll start with Delegate Kelly.
Thank you, Madam Chairman. Similar to my question for the proponents, I guess to either the lawyers that are on this panel, I believe Laura or Olivia. Mike, I have many concerns, but one of my concerns has to do with the protections against minors seeking an abortion without the involvement of their parents outside of those unfortunate circumstances that the law currently provides. Would the passing of this constitutional amendment, in your opinion, change anything as it relates to the current protections that are in the law, as it relates to this or to very late term abortions?
Olivia, do you want to speak to that from a legal perspective?
Sure, I can speak to that. So what was discussed earlier was the fact that this bill incorporates the strict scrutiny requirement that was in Roe, and that was struck down in Casey. Casey found that you could not have strict scrutiny because states have a very real interest in protecting life. That would include the life of young children who are seeking abortion. And currently, yes, they are protected because Maryland has a law in place. But what's unclear is whether this bill, if passed, would remove that protection because it couldn't pass strict scrutiny any longer. So that and also with late-term abortion is completely up in the air. This is one of the first bills that we've seen coming along. We have Dobbs in the Supreme Court's hands, but what that would probably do is refer abortion back to the states, and it wouldn't undermine any of the laws that are currently in place in Maryland, which means that there's no reason for this amendment. There's no reason for this change to the Constitution because you already have abortion in Maryland is one of the most progressive places. They allow abortion much more than other states. So I think that is a very real concern, and yes, it should be a concern to you.
Thank you.
Delegate Salega.
Thank you, Madam Chair, and thank you all for being here. This question is for Laura Bogley. House Bill 937 is a $3.5 million program that looks to me like it's going to train abortion providers, abortion clinics. In your experience here in Maryland, how much tax dollars are provided to pro-life pregnancy centers? Is it difficult for them to get grants? And give us a little bit of information about that from the care side for women who want to keep their babies and encourage women to choose life.
Yeah, Delegate Shalega, thank you for the question. You are right, that $3.5 million to train more abortion providers. And as the physician, Dr. Christensen had mentioned, that is going to be a lower skilled provider and potentially non-medical providers of abortion, particularly chemical abortion. That is, we're paying $6.5 million already now in Medicaid reimbursements to abortion providers for elective abortions, nearly 10,000 elective abortions, 0 were reported for rape, incest, life, and the other. That's the 6.5 that we know about only because those abortion providers are seeking reimbursement through Medicaid. So we don't have high protections here. We don't have protections against the use of taxpayer funds to fund abortion. We are doing that in the tune of $6.5 million. This will be an additional $3.5 million. There's an additional pass-through funding in millions to the abortion industry through the Department of Education, Department of Health that we don't know about. So because there's no reporting requirement, of course, as you know, we're one of 3 states plus DC who shield abortionists by not requiring them to report their data for CDC purposes. So we're not exactly sure, but that's the estimate. So yes, this bill will force us to provide millions of dollars additional funds to train abortion providers, which is a violation for the religious exemptions and rights of conscience for Maryland taxpayers across the state.
Okay. thank you. Are there any other questions from the committee? And last call, any other questions?
Delegate Collison, if I can address the question for Delegate Shalega specifically, she asked about government funding to pro-life pregnancy centers. There is none. They are not eligible under Maryland Department of Health guidelines that say that if you do not refer for abortion care, you are not eligible for those state funds. So that's the answer to that question.
Okay. All right, well, given that, and I see no further questions, then that concludes the hearing on House Bill 1171, 937, and 952. We will now, I want to thank again all of the panelists for being here today, for your time and your testimony. We will break now for 20 minutes, and the committee will resume in, I have to check my clock to see, so it's at 3:10. We will resume at 3:10. Thank you very much.
Richard, are you there?
Yes, ma'am.
I just heard from Bonnie that I am going to be starting the bill hearings on the
Okay.
next set of bills.
Perfect.
Okay.
Do you have the witness list with you?
Oh, crumbs. I'm sure I do. Let me find it.
Okay. Just let me know, and if not, I can just send it to you.
No, I have it. I just have to make sure that I have a highlighted printed version.
Of course.
Thank you.
Madam Chair, it's Sandy. I'm here and I have no other obligation.
Oh, Bonnie seemed to say she couldn't reach you, so maybe your phone is turned off.
I'm sorry.
It's all yours, Delegate
I need the
Rosenberg.
list, however.
I can hardly hear you, Delegate Rosenberg. You need to do whatever magic you do with your volume. Try again.
Hold on. Hitting the wrong. Can you hear me better now?
Nope.
Uh,
There you go. There you go. It's a whole
that
new
was-
world.
Okay, I need the list if I'm gonna chair a witness.
Thank you, Sandy.
Okay.
Richard, would you send him a copy of the list, please?
Yes, ma'am. Doing that right now.
Thank you so much. So you should get this in your email, right?
Hold on, one sec.
You actually got it from, I think Kathy usually sends it out.
Oh, okay.
Yeah, she sent it out about 2 days ago.
Yeah, so here's another version. If you
Sure.
can check your email and open it up. And remember, we're putting the Pat Young bills together
Mhm.
and the Novotny bills together. 5 minutes per bill for the sponsor. 2 minutes for people testifying. Unless they're testifying on multiple bills, then they get 4 minutes. Same as the previous hearing. The whole day is like that.
Mhm.
Because they're so very complicated, you may want to allow people follow-ups. That's your choice.
Mhm.
I assume we're live here. Is that true, Richard?
Oh.
Yes, ma'am. We are still live.
Just so everybody knows, the things that
Yeah.
I'm saying are very public and I want you to be clear.
Delegate Justin Fiore and Kevin Canali are testifying on all, well, Kevin Canali is testifying on all 3 bills. Justin Fiore is testifying on 2.
Madam Chair,
Yes,
I just got an email from Jeremy.
yes,
State Board of Education rescinded the mask mandate,
yes.
and there is a presiding officer's plan. He wants me to call him.
What?
Jeremy Baker wants me to call him about the AELR response to the,
If you're prepared to handle this, I'll text Jeremy and tell him you'll call him after the hearing.
fine. Okay. Thank you.
You got the lists you need?
Not yet. Hold on. Richard, did you send it to Del Sandy at AOL?
Yes, sir. You're about to get it very shortly.
Okay.
Is that where you want it sent or do you want to
Yes.
send?
Oh, yes. Yes, yes.
Yep, that's where it's going.
Okay, not yet. Not yet.
Okay, Bonnie, repeat what you just said about somebody testifying or not, somebody, not. Maybe she's left. I'll wing it. I'm gonna start. Because you can text me whenever you get the document,
And then-
Delegate
okay,
Rosenberg, and I'll turn
fine.
it back over to you.
Okay.
Okay, Delegate Cullison was called away. I will be filling in until Delegate Rosenberg may become available. I want to reiterate the rules from this morning because the people who are testifying may or may not be aware. Presenters have 5 minutes for each bill. We're grouping sponsors' bills all together. We have 2 sponsors who are presenting today, so each of them will have 15 minutes on their package of bills. I believe that's correct. I believe each have 3 bills. There will be opportunity for witnesses to testify for 2 minutes each, or if they're testifying on more than one bill, they may testify for 4 minutes on however many bills they are testifying on. We'll start with the group of 3 that are Delegate Youngs, then we'll do the group of 3 that I believe are Delegate Novotny's. And we'll separate those 2 hearings so you can ask questions about the first group or the second group. So we're gonna separate them by sponsors. We give each sponsor that much time and that much attention. So with that, my list has me starting with Delegate Young.
Thank you, Madam Chair. Well, Chair Pendergrass.
Did my direction make sense to you?
Yes, ma'am.
Okay.
And since we'll be going through all 3, I'll read through my testimony on all 3 bills.
Thank you.
Excellent. Chair Pendergrass, Vice Chair Peña-Melnick, and members of the Health and Government Operations Committee. It's a pleasure to be in front of you again, to present 3 bills, all related to Maryland's cybersecurity posture and modernizing our approach to cybersecurity. HB 1202, HB 1205, and HB 1346. You have my written testimony, so I will proceed to go through my remarks that I've made on each individual bill and then move to my panel. For the record, I'm Delegate Pat Young, Chair of the Baltimore County Delegation and House Chair of the Joint Committee on Cybersecurity, Information Technology, and Biotechnology. This time, I'd like to make an acknowledgement to the House members of the Joint Committee, many of which are members of the HGO that are present today: Delegate Sandy Bartlett, Delegate Jessica Feldmark, Delegate Ariana Kelly, Delegate Ken Kerr, Delegate Nick Kipke, and I would be remiss if I didn't acknowledge the welcome presence and also Council Delegate Sandy Rosenberg, Chair of the Government Operations and Health Facilities Subcommittee under this committee. And of course, my Senate co-chair, Senator Katie Fry Hester. Thank you for your work and dedication to the Joint Committee and Maryland's long-term security. For context, it's important to inform all of you that the bills that are before you are the first versions crafted by our talented and capable drafters. We did not receive them together until Monday before our drop deadline, leaving us little time to review, as well as to make initial adjustments to the language before making our drop deadline. With that in mind, it would not be helpful or constructive for you to read or reference the first drafts of HB 1202, HB 1205, or HB 1346. That being said, though, considerable time and effort has been put in by staff, leadership, and members of this committee to address concerns, eliminate redundancies, and make amendments to produce a legislation that reflects the work of the Joint Committee, the recommendations of the Maryland Cybersecurity Council, and the intent of the presiding officers. I'm confident that the subcommittee of this committee will have a workable reprint of each bill with ample time to review, as well as produce and ask for additional amendments if needed in a timely manner. As legislators, we all are familiar with the reality that we tend to have with our own timelines, but that doesn't always meet up with the bureaucratic timeline that we're presented with. So I appreciate your indulgence, and we'll move to the intent of each of these 3 bills before us, which I believe meets the charge that was presented to us over the interim by the presiding officers. HB 1346 is the bill that deals with coordination and governance in state government's cybersecurity postures. It moves us to a more centralized and consolidated model of governance over cybersecurity matters across executive branch agencies. While HB 1346 expands the role and responsibilities of DO IT, it is not our intent to usurp other departments' general IT authority as it exists to manage their day-to-day agencies and procedures and operations. It creates the Office of Security Management inside of DO IT, and we have requested amendments that would clarify language as it relates to DO IT's relationship with local governments. It codifies the Chief Information Security Officer, or CISO position, and codifies the existence of the Maryland Cybersecurity Council, and clarifies that the role of the coordination offices as it relates to the relationship between local governments is specific to these agencies, as well as the positions that are hired within them. Additional amendments will also carve out independent agencies such as the State Board of Elections and the legislative branch so as not to compromise their independent status. HB 1205 addresses oversights. As we move in this new direction, it establishes an oversight commission that will maintain the purpose and the intent of these bills and require DO IT, the CISO, and MDEM to provide regular updates on cybersecurity efforts and duties. It reinstates procurement authority under DO IT and increases the amount or cost threshold that will require DO IT to go to DGS for approval of certain procurement projects. The thinking here is that these are very expensive procurement projects that tend to rely on or relate to cybersecurity, where a normal threshold of $100,000, for example, would be the equivalent of purchasing a pencil as related to cybersecurity needs. Amendments would also make sure that we take out the language that discusses change orders and provisions that would further provide oversight over procurement and also over contractors that would be contracted through DO IT. HB 1205 also clarifies the timeline that DO IT must hire an independent contractor to perform its out-of-state cybersecurity infrastructure assessments, and will also establish a grant process, a fee-for-service system that will provide at cost by the state access assessments that are accessible by local governments that will then unlock funds through the cybersecurity fund that we've created once they've gone through the assessment, either through the state or through an approved agency through DO IT. HB 1202 addresses emergency response and the relationship being established between local and state government. It will establish a preparedness office that will work with local governments in their day-to-day cybersecurity procedures and in their efforts to modernize and eliminate a legacy system. It will create mechanisms for MDEM to respond appropriately to cyber attacks on the state or local level, and it will clarify and establish avenues for infrastructure sharing and accessing resources in the event of a cyber attack at the state or local level. During the interim, the Joint Committee on Cybersecurity, Information Technology, and Biotechnology received presentations, reports, testimony that included modernization strategies to enhance Maryland's cybersecurity posture. The Ad Hoc Committee on State and Local Cybersecurity of the Maryland Cybersecurity Council submitted a report that contained analysis of local and state government cybersecurity capabilities and needs, as well as recommendations of how to modernize both. The Joint Committee was charged with producing legislation that would address the following: modernizing the state's infrastructure and legal framework for information technology. 2, ensuring the state government has the capacity to implement and enforce cybersecurity policies, practices, as well as strategic plans. And 3, to the extent practicable, identifying policies that support cybersecurity's best practices across all levels of government, state, local, and municipal. I believe these 3 bills meet this charge and then some. And to be clear, these bills represent a starting point, not an end state. I look forward to the continued collaboration and conversation around how Maryland can better secure itself and our local partners. And it is my belief that we will set ourselves apart and no longer be seen as a lucrative target for those that would seek to do us harm and disrupt the services that Marylanders have come to expect and rely on by our state government. With that, I thank you for your time and your consideration, and I urge a favorable report. And Madam Chair, if I could either answer questions or move it to the panel for additional comment.
Well, I am chairing now,
Oh.
Delegate Rosenberg here. That's fine. Do you wish to take questions now, or would you prefer to wait to have the various panels speak?
Yeah, I think we should move to the panel. I had two members.
Fine.
Thank you.
Okay. First individual who is testifying is Justin Fiore from the Maryland Municipal League. Followed by Kevin Kennedy of MACO. Mr. Fiore, you're up.
I can speak. I'm not with the panel, I don't believe, but name's Justin. Good afternoon, Mr. Chair, Madam Chair, members of the committee. I'm here on behalf of the Maryland Municipal League in support of this bill, Bill 1220, and really the whole cyber package. You have my written testimony. I'll be brief. I just want to thank the sponsor for introducing the bill, his work as chair of the Joint Committee on Cybersecurity, Information Technology, and Biotechnology, as well as the rest of the members of the Joint Committee. We believe what you have before you is a great model for state and local government partnership to combat the challenges local governments face in the cyber age. We would like to work with the sponsor and the committee to ensure funding isn't only available to those in compliance with the department standards, as those who need to come into compliance are probably also in greatest need of assistance. So we can find language that requires such jurisdiction to have a plan to come into compliance to be eligible for funds. But we respectfully request a favorable report on all of these bills. Thank you for your time.
Okay. Would all the panel members are here, so if you could please testify in order, whatever order you wish.
If I may, Mr. Greg Von Lehman. First. Go ahead.
Let me interject here. Let me read from the witness sign-up list, which I have in front of me.
Okay.
We need to hear from Justin Fiore, who I don't think was called on. I think we heard from Kevin just now. Is that accurate?
Justin just spoke.
Oh, then it's Kevin I need to call on.
Okay.
Good afternoon, Madam Chair and members of the committee. Kevin Canale here on behalf of the Maryland Association of Counties in strong support of this entire package. I know that you don't have necessarily the amendments before you, but I just want to say MACO participated in this work group, this ad hoc study over the interim, and we're quite confident that what Delegate Young just laid out is going to put the state and local governments in a much better posture when it comes to cybersecurity. We view this as a partnership. We need a strong partnership here between the state and local governments because we know that hackers are increasingly targeting states and local governments with sophisticated cyber attacks. And of course, we have sensitive information. It jeopardizes public safety and it jeopardizes the delivery of essential services that we provide every single day. So I think through things like shared service agreements and network monitoring and statewide risk assessments, we can move forward together and really become a partnership and more in sync when it comes to addressing these joint threats. I appreciate that Delegate Young referenced legacy systems. That's a big problem, and particularly with some of our health departments, that became clear during COVID. We had people that were relying on technology that is just outdated, and we need to upgrade that to make sure that we can safeguard that critical data and the sensitive information that I spoke about earlier. So we really urge the state, and we're happy that the state is prioritizing this issue. And we think that this package is vital to, again, addressing our cybersecurity posture. And by dedicating the needed resources and streamlining collaboration, communication, and coordination, the state can help lead local governments, school systems, and critical infrastructure toward a more cyber secure future. So we'd urge a favorable report on these bills. Happy to answer any questions, and we look forward to working with the committee and the subcommittee as we move forward to present an entire package that really addresses the concerns of the state and the local governments. And again, thank you for having us, Madam Chair. I'm happy to answer any questions.
Thank you. We will now turn to Greg Lehman.
Thank you, Madam Chair. I think Kevin very ably expressed the support of county governments for the legislative package. I'm confident, speaking on behalf of the ad hoc committee on state and local cybersecurity, that all the members of the ad hoc committee support the bills in this package very strongly. The study effort was an inclusive one. It included representatives of DO-IT, the Department of Emergency Management. Kevin represented MACO. There were additional discussions with county, school board, IT staff, county health officials, formal surveys of of county governments and state agencies, and a good bit of consultation with IT and cybersecurity professionals working in other states. So the result of that effort was 35 recommendations addressing kind of general questions of governance, cybersecurity practice at the state agency level, and also the needs of local governments, school boards, and school districts. So, as an academic, I'm just thrilled with the fact that we're able to do a study which took about 6 months, and then have the study actually potentially inform public policy. So let me see how much time I have here. So I'll just say that the recommendations fall in those 3 buckets: governance, state agency practice, and local government cybersecurity. 35 recommendations in all, supported by a lot of fact finding, and I'd be very happy to answer any questions that may touch on those recommendations as they are embodied in the bills.
Okay, thank you very much for your testimony. Next, we will hear from, I have no one else signed up on House Bill 1202. And on House Bill 1205, I have Michael Friends. Are you here, Michael?
Thank you, Madam Chair, members of the committee. With respect to 1205, we at the Stadium Authority, we're not opposed to the legislation in and of itself. However, we have serious concerns about our participation in this program, and we've submitted written testimony outlining the reasons for our reservations, so I'm happy to answer any questions you might have.
Okay. We will now call on Thomas Kelso.
Madam Chair, Mr. Kelso is the chairman of the Stadium Authority. He shares those concerns, and I don't believe he is on the call.
Okay. I have him listed to testify, so I'm glad I called on him, and we're happy to have heard from you representing that agency. Thank you. Now I will turn it over to questions. And I know that this is at this point what's written, and we know that it's going to look a lot different. And as you all know, we do our work mostly in committee, subcommittee, I mean, and so there will be a lot of work done on this bill. So with that, I'll turn it over to Delegate Kipke, who I know has worked on this, and I thank him for that.
Thank you, Madam Chairman, and thank you to Delegate Young and everybody involved in this. It's a big undertaking, and I'm sure there's no way to do this perfectly, but I know everybody's going to try. I think the right person to answer the question might be Greg Von Lehman, but if that's not the right person, maybe Delegate Young can correct me. In reference to what Michael Friends just brought up with the Stadium Authority, I've also heard from the airport, the port, the different authorities that are not funded with just general funds, I guess, might be the thing that they all have in common. I'm curious if there's been any thought put into separating them out. I know that they often receive federal money for different things, and I don't know if that's the genesis of the concerns of separating out this work to another agency. Perhaps you could shine a little light on that, since I've heard from so many people about it in the last few days. Thank you.
I think I can address it based on the changes in conversations, especially since the bill went public. Folks have reached out related to the language as it currently stands. And I mentioned in the remarks, it's not our intent to put in jeopardy or usurp current relationships that agencies may have. and we're working in terms of language that has been used in other states to make sure that an imperfect example would be the idea that USM is the University System of Maryland, Towson is its own entity, College Park is its own entity, but they're all part of this USM system. This is an imperfect example of, when we're talking about cybersecurity, a unified approach and coordination and working together while not jeopardizing any individual agency's ability to do the jobs that they provide.
So it sounds like you're working on it.
Yes, sir.
Okay, thank you.
Delegate Rosenberg.
Thank you, Madam Chair. Presumably the Delegate Young or whoever, concerns have been raised about separation of powers and the extent to which the executive branch can compel the other two branches, the judicial and the legislative, regarding policies and practices in this instance. Have you considered that at this point?
Yes, and in 1346 language towards the end, we specifically state agencies that we believe are independent, such as the Board of Elections, the legislature, and judiciary as being separated out.
Thank you.
I see no other hands. That said, let's be really clear. There's a lot of information here and a lot of effort is going to go into figuring this out. We do thank everybody for their participation in all the work that's been done so far. And we do take this very seriously. We have certainly seen the effects in our state with that cyber hack on the health department, and we continue to reel from the repercussions of it. So thank you very much for being here, all of you. I believe, unless Richard directs that I've forgotten something. Oh, I know. We will now start with Delegate Novotny's bills. That ends the hearing on those three bills.
Thank you, Madam Chair.
You're very welcome, Delegate. We appreciate all the work you did with your group.
Thank you, Madam Chair. Do you mind if I begin?
I'd love for you to begin.
Okay. Good afternoon, everyone. Good afternoon, Madam Chairwoman Pendergrass and members of the committee. My name is Delegate Reed Novotny, representing Howard and Carroll counties. I'm excited to present two bills, and this first one is House Bill 346, Department of Information Technology Oversight of Legislative Branch Information Technology. Cybersecurity should be handled as a whole of government effort in our state. At this point, it is not. There's no good reason that a state continues to fall prey to the simple script kiddie hackers, ransomware criminals, and the most dangerous to our citizens, the advanced persistent threats, APTs, from North Korea, Russia, China, Iran, and other terrorist organizations. I know for a fact these APTs don't care about our separation of powers. They attack where we are vulnerable. This bill allows for the Department of IT to help our legislative branch increase their cybersecurity posture. It is proven that consolidated cybersecurity services can both increase security and reduce cost and complexity at the same time. I want to thank you for your time and ask you for a favorable report on House Bill 346. Thank you, Madam Chair. And if you don't mind, I will go to my next bill. Good afternoon again, ma'am. My name is Delegate Reed Novotny, representing Howard and Carroll counties. This is House Bill 348, General Assembly and Legislative Branch of State Government Security Training, Protecting Security Sensitive Data. Users are the most vulnerable part of a cybersecurity infrastructure. User education is the best way to address this gap in cybersecurity. The legislative branch does not require cybersecurity training, and the state's Department of IT already provides this training. I am proposing the legislative branch take advantage of this training to ensure we strengthen our cybersecurity posture. As you will all see in the news and have talked about here, there are new breaches and infections of ransomware attacking our government daily here in Maryland and around the US. The number one way to have a ransomware take over your network is from poor user cyber education by doing things like clicking on malicious files or links. This bill will increase our cybersecurity posture so we can continue to work on behalf of the people of Maryland. I want to thank you for your time and ask for a favorable report on House Bill 348. Thank you, Madam Chair.
Do you have a third bill, Delegate Novotny?
No, ma'am, just those two. I believe the next one is.
Oh, I'm sorry. That's right. That's the administration. Okay.
Thank you, ma'am.
Thank you for pointing that out. All right. I'm going to ask people who are here to testify. And I'm going to start with hopefully the right sign-up sheet here. Let's
Madam
take.
Chair, I think Delegate Hill had a question.
I think we'll wait until we hear from the people who are testifying. Who just alerted me to that?
It's Delegate Collison, but I didn't think that there were any other panelists on Delegate Novotny's bill.
Oh, you're right. It's only on the speaker's bill. That's my problem. Okay. Thank you very much. Why don't you take over now that you've returned, I presume?
I have returned. Thank you.
Okay, and we're all happy since you did the prep. Thank you.
Thank you. Delegate Hill.
Thank you, Madam Chairman and Madam Chair, and Delegate Novotny, thank you very much. And I know you've got great expertise in this. I just wanted to ask if you could elaborate a little bit more on the first bill that you presented. You point out that, no branch of government is sacred and they all interact. But in your first bill, you're adding the legislative branch, and I read it quickly, to requiring the same management directions with respect to IT. So I just want you to elaborate why this is important, because I think we think of the executive branch as administering programs. And so if they're hacked, it can really shut things down. In the legislative branch, we propose things, but we don't really administer things. So why is it still important that we would follow the same kinds of best practices?
Delegate Hill, thank you so much for that question. And you're exactly right. In cybersecurity, you only have to be right as a hacker one time. It's like playing defense. The defensive team has to be right 100% of the time. In my opinion, we have a great cybersecurity team that's actually located within our state, the Department of IT, that runs a lot of these services, and they can run them broadly for multiple entities. And it is, I think, a waste of effort. And then the other aspect that we're not taking advantage of these different services that are offered by the Department of IT. And then looking at the other side of the coin also is that the people trying to attack and take our information, to include information that we use here, the services we use here, can be vulnerable. I mean, this is more in my wheelhouse, but the fact that we don't even have screensaver passwords or the ability to have port, there's a lot of issues that I won't bring up in an open forum, that if someone was going to be malicious, they could walk around our offices and take control of a lot of our data here. My suggestion is we don't reinvent the wheel. We actually use some of the great practices in our Department of IT and help the legislative branch get better in cybersecurity. That's it.
All right, thank you.
Thank you, ma'am.
Are there any other questions from the committee? Seeing none, that concludes the hearings on House Bill 346 and 348. Thank you, Delegate Novotny, for coming today.
Thank you, ma'am.
And we'll move to House Bill 419. This is a administration bill, and I think it's going to be presented. It's State Government Information Technology, Cybersecurity, and it'll be presented by Charles Stewart.
So it'll be Aaron Chase and myself.
Yes.
Thank you, Madam Chair. Good afternoon, Chair Pendergrass, Vice Chair Pena-Melnick. My name is Aaron Chase with the Governor's Legislative Office, here to ask for your favorable report on House Bill 419, State Government Information Technology, Cybersecurity. With me today is Chip Stewart, the state's Chief Information Security Officer. First, I'd like to thank the chair and committee members for working with the administration in the past to pass important legislation related to cybersecurity and data privacy. In today's growing digital age, cybersecurity has become more important than ever. We live in an era where new technology is emerging each day and where there are more malicious actors than ever trying to gain access to sensitive information, networks, and critical infrastructure. Recognizing the urgency needed to protect the state's digital assets, Governor Hogan issued an executive order in 2019 to create the Maryland Cyber Defense Initiative. which established the Office of Security Management, the State Chief Information Security Officer, and the Maryland Cybersecurity Coordinating Council. These three elements make up Maryland Cyber Defense Initiative, which are a collaborative and comprehensive effort that works tirelessly to identify vulnerabilities, mitigate any potential threats, and strengthen the state's defenses, all of which ensure that our assets are protected and secure. Modernizing our cybersecurity defenses and securing all of the state's networks remains a top priority for the Hogan administration. The legislation before you today simply seeks to codify the executive order to ensure that our cybersecurity structure, strategy, and framework are all set in stone. In fact, this committee and the House passed an almost identical version of this bill during the 2020 session. Additionally, the cybersecurity bills you heard earlier from Delegate Young also seek to codify the Maryland Cyber Defense Initiative Executive Order. There have been many different pieces of legislation introduced this session that address various aspects of cybersecurity, and we greatly look forward to working with the committee on this important issue. For these reasons, the administration respectfully requests a favorable report on House Bill 419.
Thank you, Ms. Chase. Mr. Stewart, were you going to present or
Yes,
are you here for questions? Okay.
Great. Well, thank you. Good afternoon, Chair Pendergrass and members of the committee. For the record, my name is Chip Stewart. I'm the State Chief Information Security Officer. As you know, cyber threats are increasing on a daily basis across the world. In an effort to strengthen the state's cyber posture while also solidifying its ability to manage and minimize the consequences of a cyber attack, in the summer of 2019, Governor Hogan signed the executive order which created the Maryland Cyber Defense Initiative, which included my position. In an effort to create this unified statewide cybersecurity program, the Maryland Cyber Defense Initiative created the Office of Security Management and the Maryland Cybersecurity Coordinating Council. House Bill 419 codifies the governor's executive order into law. My role as State Chief Information Security Officer is to protect the confidentiality, integrity, and availability of Maryland information systems and state-owned data. In this effort, I lead the Office of Security Management, directing, coordinating, and implementing the overall cybersecurity policy for all state agencies within the executive branch. The Maryland Cybersecurity Coordinating Council, or MCCC, provides policy-level guidance regarding the implementation of the cybersecurity program, as well as working alongside internal and external stakeholders to provide recommendations to help build and sustain the capabilities necessary for the state to identify, protect, detect, respond, and recover from cybersecurity-related risk. The MCCC is comprised of state officials representing numerous agencies and departments throughout the state. Having high-ranking officials from numerous agencies is a huge asset in coordinating cybersecurity strategy. The bill also requires the legislative and judicial branches of government to certify they're meeting minimum cybersecurity standards when they connect to Network Maryland. In addition, the bill mandates all executive branch agencies send a report to the governor comprised of a data and systems inventory. For that reason, I would ask that you give House Bill 419 a favorable report, and I would be happy to answer any questions you may have.
Thank you, Mr. Chase. Or Stewart. Delegate Bandari, please.
Thank you, Madam Chair. The Maryland judiciary opposes the House Bill 419 with the concern that it applies to the judiciary as it impedes the judiciary independence. Have you seen that opposition?
I have not seen that opposition. I don't believe that anything within 419 creates a new obligation for them, though. I'd be interested to see what they responded with.
Thank you.
Delegate Krebs.
No, I was just trying to read the bill, and I had the same question. Judge Getty, Chief Judge, basically said they opposed it because of the separation of powers. So I was trying to read the bill very quickly. From what you know, is the judiciary included in this as well?
So the only obligation for the judiciary applies to them meeting the minimum standards required to connect to the state's IT network. If they choose not to meet those standards, they can choose to not connect to that network.
Great, thank you. I suggest that you communicate with them that explanation and get them to maybe remove their letter of opposition or clarify it. Thank you very much.
Absolutely, thank you.
Thank you, Delegate Krebs. Are there any other questions from the committee? Okay, seeing none, that concludes the hearing on House Bill 419. 19. And the work before us today, I want to thank everybody for their time and testimony. And we will be having hearings tomorrow at 1:30. And